Handling infectious samples in the lab is a critical task that we must approach with the utmost care and precision. The risks associated with mishandling these samples are significant, not just for the individual handling them, but for everyone in the lab environment. Let's talk through the essential steps for ensuring personal protection when working with samples such as viral hepatitis, HIV, or rabies. These pathogens can cause severe health issues, and it's crucial to follow strict protocols to minimize any risk of exposure. First and foremost, always remember to wear gloves before performing a venipuncture. This is non-negotiable. Gloves act as a barrier between your skin and the potentially infectious material. Gloves are your first line of defense against potential infection. They help prevent direct contact with blood and other bodily fluids that may carry harmful pathogens. When transferring blood from the syringe to the container, exercise due care. This step requires steady hands and full attention to avoid any accidents. Preventing spillage or splashes is crucial. Even a small drop can lead to contamination and pose a health risk. These accidents can pose significant risks, not just to you, but also to your colleagues. It's important to be mindful of your surroundings and the people you work with. Next, once the blood is in the container, it's time to label it. Proper labeling is essential for ensuring that everyone who handles the sample is aware of its infectious nature. Use a red marker to clearly indicate that the material is infected. This color is universally recognized as a warning sign, making it easy for anyone to identify the risk. This is a visual cue that alerts everyone to handle the sample with the necessary precautions. Proper labeling can prevent accidental exposure and ensure that the sample is processed correctly. Make sure the container is airtight. An airtight seal prevents any leakage or contamination, which is crucial for maintaining a safe lab environment. This step prevents any leakage or contamination. It's a simple yet effective way to ensure that the infectious material stays contained. Also, don't forget to paste red stickers on the request forms. These stickers serve as an additional warning to anyone who handles the paperwork, ensuring that they are aware of the potential risks. Now, communication is key. Clear and effective communication can make a significant difference in maintaining a safe lab environment. Inform the respective departments that will be carrying out the tests about the infectious nature of the samples. This ensures that everyone involved is aware and can take the appropriate measures to protect themselves. Effective communication can prevent misunderstandings and ensure that safety protocols are followed correctly. To recap, wear your gloves, handle samples with care, and always be mindful of the potential risks. Label and seal containers correctly and communicate effectively. These steps are your best defense against the risks associated with handling infectious samples. Following these protocols can significantly reduce the risk of exposure and ensure a safer working environment for everyone. Stay safe, stay informed, and always prioritize safety in your daily tasks. And remember, vigilance is your best tool in the lab. Being vigilant means being aware of your actions and surroundings at all times, which is crucial for maintaining a safe lab environment. Thanks for watching. Keep these tips in mind, and let's create a safer working environment for everyone. Your safety and the safety of your colleagues depend on following these guidelines. Keep these tips in mind, and let's create a safer working environment for everyone. Together, we can ensure that our lab remains a safe place to work, where everyone can perform their tasks without fear of exposure to infectious materials.